What is the process that a patient would typically go through regarding these options?
Most patients have to be referred to a pain clinic such as ours. They'll be evaluated, they'll be examined, X-ray results will be reviewed as well as laboratory results. A diagnosis will be given to the patient. Depending on the diagnosis, the correct treatment will be formulated and explained to the patient. The day of the procedure, patient arrives to a setting such as an ambulatory surgery center or a hospital. The procedures take about 30 minutes to 60 minutes, depending on the procedure.
That's not too bad at all, doctor.
Not at all. And the recovery is about 30 minutes to 45 minutes, and then patients can go home. This is done as an outpatient procedure. Depending on the procedure itself, patient may have different results right after the procedure.
We're now going to meet Michael, a patient of Advanced Pain Medicine Institute. Welcome, Michael.
Hello.
It's always good to have patients on, and I appreciate you taking the time and coming down and joining us for a few moments. And let me start right off by asking you what type of pain we're experiencing and where.
I've had constant pain in both of my hips, and I also have pain on my right leg down the front to my knee.
And how did that affect your life?
It doesn't give me much of a quality of life. I mean, without medication and treatments, I pretty much work and laying around the house because just the pain is too much to stand too long or to sit too long or to pretty much do anything.
So it was affecting you from even going to work based on what you just said?
Definitely.
And what did you have done?
Well, between the medicine and the epidural injections I get here, it allows me to improve my quality of life, so to speak. It doesn't totally take away my pain, but I manage to go to work every day and do most of what I want to do.
And how long have you been going through these treatments?
I've had about 12 treatments so far, and I'm constantly taking medication, but when the medication stops to work, it's time for another course of injections.
You tried surgeries, from what I understand, and to no avail.
Well, I suffered an accident where I had to have surgery, and I've had numerous surgeries, and only get worse as surgeries go on, so this seems to be my last resort.
Well, it's helping you manage the pain and helping you in a manner that the surgeries obviously didn't.
My quality of life isn't where I want it to be, but I manage to go to work every day.
And that's very important.
It's very important.
On that note, I'd like to thank you, Michael, and joining us here today on The New Me.
You're welcome.
We're now back with Dr. Ghorbani. I must say, Michael certainly at least is able to go back to work, something that he couldn't do prior to these treatment options. He had tried surgeries in the past to no avail, and now he's at least managing or minimizing the pain and certainly seems happier than he did prior to these options.
As you can see from Michael's case, he had tried everything, even surgery, and unfortunately he was still in a great deal of pain. And we were able to give him some relief to minimize his pain, and he'll become more functional and have a more normal life than he did before.
And how long would the pain relief last?
Again, depends on the procedure. There have been cases that patients, for example, have a herniated disc and they get 1 or 2 injections in a 2-week interval, and that could last forever. There are patients who receive the same injection and that could last them about 6 months to a year. It's safe to do some of these injections 4 or 5 times a year. There are other procedures that we perform that it's a definitive treatment, and those could last forever unless people have recurrence of their condition, like any disease.
So it basically depends, again, as you touched on a few moments ago, the specific problem with that specific patient and how he or she responds to the treatment and how many injections, for example, if one goes that route, it would be based totally on the response to the body and their particular problem.
And again, depends on what procedure patients are having. Some procedures done in a sequence of 2 or 3, and some are done just one time is a definitive treatment.
How safe are these treatments?
Most of these treatments have been around for a long time. First epidural injection was done in 1901. And since then, a lot of perfection has been done to this procedure.
That's a long time ago. It's been around.
Exactly. We use X-ray guidance for needle localization, so we know exactly where the needle is located, and as well we inject contrast dye, and we can see the spread of the medication exactly where it needs to go. And these two add huge amount of safety to these procedures that we perform.
Well, that's always good to know. And are there any side effects that we may experience with any of these treatment options?
The beauty of these injections is that we inject a very small amount of the steroids where the problem actually is, compared to when patients get pills in the form of steroids. This has been prescribed by some of the physicians who don't perform these procedures. When you take a pill, you take a huge dose and you develop side effects because most of the amount of steroid doesn't go where it needs to go. It's a waste. So they need to give you huge dosages. With these injections, people have minimal side effects.
Well, that's very good to know indeed. Now, we've only got a few moments left, Dr. Ghorbani, and I have to ask you before I let you go if you have any final thoughts that you'd like to share with our viewers.
Well, the future of treating lower back pain appears to be very promising as well as interesting, with the potential of reversing the degenerative changes associated with discs and joint capsules. We are able to restore the function in the future, as well as decreasing the pain and practically giving you a new back.
And how important that is to so many of us who suffer continually from the back pain, which in so many cases can be debilitating.
Currently, research is being done to inject growth factors as well as genes that produce these growth factors in the area that needs regrowth.
Well, that was certainly very informative and very helpful. And on that note, I'd like to thank you, Dr. Ghorbani, for joining us and being a guest today on A New Me.
Thank you very much for having me, and I hope to return.
We'd love to have you back.
Thank you.